What's the differential diagnosis of tennis elbow? There's a few different diagnoses that could masquerade as tennis elbow, right? One of them being cervical radiculopathy. You want to screen out the neck to make sure that pain on the outside of the arm is not coming from a nerve root injury. Okay. You also could be dealing with a bit of frozen shoulder that causes some pain down to the elbow. All right. So make sure you're ruling out any sort of shoulder pathology. You might be dealing with a radial tunnel syndrome. So more of a nerve injury. So the radial nerve is going to travel down the outside of the elbow where folks can have tennis elbow symptoms, right? Might be dealing with a lateral plica syndrome problem. Posterior lateral elbow instability could masquerade as tennis elbow. You could be dealing with an inflammatory edema problem. And really, you want to rule out for any sort of humeral radial joint pathology, right? So basically, if you have pain in your humeral radial joint, that sits right next to the lateral epicondyle. So make sure you're ruling these things out before you start treating someone for tennis elbow. So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain-Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay, so a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a Fitness Pain-Free Mini Course. Definitely check this out.